Well, one of the big things always being discussed on Capitol Hill and around the country right now is health care. And as the Obama health care plan continues to go into effect, we learn more about it. Craig Gusson, our insurance expert, joins us here this morning with another update on the things that you need to know. I'm seeing what I think is a developing pattern here, but I don't want to make too many assumptions, but I see this article here about SeaWorld reducing part-time hours.
Yeah.
Is that healthcare related in terms of how many hours people work and the coverage they have to be offered under the new healthcare rules?
They say it isn't, but the timing of it is such that you got to think it's somewhat related. I mean, and I understand because if you're not working 30 hours a week, you don't have to provide health insurance. And when you have a company such as SeaWorld and all the big companies, they're looking at what it's going to cost to provide health insurance, and you just can't do it, especially in today's economy.
It's just the economics of this. We're still learning as we go along, and there's many businesses that have they're having to make the decision if we have to provide health care. Health care is still very expensive, even under the government plan.
Mm-hmm.
We can't turn a profit, so we have no business being in business if we have to offer this this health care. It comes off of our bottom line, and then there is no bottom line.
Yeah, and when you have a place like SeaWorld, you probably can get away with more of the part-timers than you can if you have a regular company, because you can't have everybody go part-time. So for me, it makes business sense if that's the reason why they're doing it, even though they say it isn't.
Now, is there some reason why companies should avoid saying that that's the reason they're doing it, if they're cutting people's hours back?
Well, I just think it's bad PR for them.
Okay,
so I think they stay away from it.
Okay, but there's no legal reason why they should
not
say anything.
A lot of companies are going to be cutting back. They got a year to do it because the law was put off for a year. But you know, companies are going to start planning now for next year and the next couple of years, and I think this is one of the things that we're going to be seeing a lot of.
Let's talk about the folks that looks like they may benefit from this, and more than others. And you pointed out the group that's 50 and above, 50 years older and above, looks like they might be in pretty good shape under the new health care rules.
It was actually a surprise to me because I went to Covered California's website and I started looking at numbers, and I was really surprised that if you have a 60-year-old making $32,000 a year, the net cost of his health insurance after the subsidies by the government is like $88 a month, which isn't bad. I mean, it's the bronze plan, which is the
the basic plan.
Right. But at least it gives you pretty good coverage. So if you're making under $46,000 a year as an individual, or $62,000 a year for a couple, you can get health insurance and you get some subsidies. And when you start looking at the thing that really surprised me was that the subsidies were higher in the lower incomes for people who are age 50, 55, and 60 versus the 20 and 30-year-olds. And the reason was because their health insurance costs them more. People who are 50 and above are going to have more health issues.
Sure.
So that's why you see a bigger percentage of them today can't get health insurance or they can't afford it.
Again, I want to remind everybody that what we're really talking about here is we're talking about the people that do not have their health insurance through their company.
Correct.
The vast majority of people that have health insurance have it through their company, do they not?
Yeah, I think the numbers I saw last were close to 60% of people have it through their employer. So the ones that don't have it through their employers, those are the ones it's really going to affect. And you have a lot of people who are only at their job because they have to be, and they'd love to become self-employed, but they can't afford to go without insurance. So they stay with their job or they don't change jobs for that reason. So this is going to allow them the opportunity to do it. And also, if they're not making a lot of money, they're going to get subsidies where they're not financially strapped to say, oh, what am I going to do?
But the interesting thing to try to figure out here is when you're looking at your salary, it's hard to know how much of your compensation package is actually represented by health care. It's hard to put a dollar figure on that. You know, if you make $50,000 a year, for example, and you have full health care coverage, how does somebody know what that's worth to them to make the decision? I'll go to a job that doesn't provide health care and I'll pick up health care on my own. How do you start to compare the numbers?
It's interesting you said that, because starting next year for companies over 250, if you have more than 250 W-2s, you have to have it in box 12 of your W-2, how much the company paid for your health insurance.
So you're going to have that number.
You're going to have that if the company you work for has more than 250 W-2s that they do in a year. But I think it's a big thing, because people are always looking at how do I know how much health insurance is? Is it better to be on my wife's plan versus my plan? And I think we need to have more transparency to that so people get a better idea of what it really costs. And unfortunately, a lot of employees don't know what it costs and don't really realize the big benefit that the employer is
I was
giving
going to say,
them.
sometimes your job might look a lot better to you when you realize what
Exactly.
your total compensation package is.
That's exactly the point. We
Right.
find that a lot, and a lot of it's just the education process. In the next 30 to 45 days, that's all I'm doing. It's like almost every day now I'm going to a meeting from a different company, health insurance company, talking about what they're doing. Blue Cross had a 3-hour meeting with us yesterday explaining where everything's going to be going next year, but they still didn't have all the answers. And
Right.
it's what, September 12th, and we still don't have answers to like what the cost is and some of the basics for another 30 days.
And that's why we have you coming back about
Yeah.
once a week now to keep us updated. Craig Gusson, thank you so much.
My pleasure.
It's always good to see you.